First off, your carpal tunnel syndrome may not be carpal tunnel syndrome at all. It may be trigger points coming from the forearm flexors that can mimic carpal tunnel symptoms. You'll want to refer to a myofascial trigger point therapist for a second opinion because I've had several patients get unnecessary surgeries. Also, vitamin B supplements, and specifically vitamin B6, as well as cardiovascular exercises, are helpful for this condition. The self-massage treatment starts with a tennis ball, and you can put it on a table and put your arm on the tennis ball like this and roll it back and forth, applying a lot of pressure, using your body, not your arm, to create pressure. And at some point, as you're massaging with the tennis ball, you might feel that familiar trigger point that is going into the hand. When you feel that, just create pressure and work in there. The tennis ball may not be enough pressure for you, and this is where the Theracane also comes in very handy. Put it like this on your thighs. Open up your thighs just to make it secure, and bring your arm down and do massaging. And you'll find that the trigger point might appear a little further up close to the elbow. And once again, as you're massaging in here, if you do feel a sensation running down into the hand, that's a trigger point, and you'll want to hold that for a full minute, taking deep breaths. But with the Theracane, you can massage the entire forearm and even down into the wrist, because the carpal might be getting trapped in the wrist area. So it's important to massage this area as well. To stretch this muscle, you'll want to lock out the elbow, rotate the arm so the hand is palm up, put this hand here and just pull back gently. So you can see that in this position as well. When it's in this position, I want you to very lightly push up against your hand without changing the range of motion. It's called stretching against resistance. So go ahead and push with your fingers, and you're not going to see any change. Relax, see if you can get a little more of a stretch, and then once again with about 10% of your strength, push again. And hold that for 5 to 10 seconds. And then the other arm with that hand palm up, go ahead and extend that fingers back and then help out with this hand. But most of the pressure is not going to be pulling back. It's going to be pushing forward again in this direction, but without changing the range of motion. So right here, and push 10% of your strength for 10 seconds. And relax. And then push again, 10% of your strength for 10 seconds. And again, you can do these stretches for a couple minutes. Another helpful stretch that could be done up against the wall, or I'm going to be doing it against the table, is bring the palm over to the 3 o'clock position and then rotate the body in the opposite direction. If you're doing this against the wall, you want to do the 3 o'clock position and then walk forward. But for the sake of the seated position, you'll want to rotate. If you feel too much tingling going down into the arm, just back off a little bit. And then when the tingling goes away, try to rotate again into the opposite direction and feeling that stretch. Then the other stretch you'll want to do up against the wall or a table is bringing the palm down to the 6 o'clock position. And because carpal tunnel syndrome, and because the nerve that supplies that carpal tunnel comes from the neck, sometimes the neck can be involved as well. So with this one at the 6 o'clock position, you'll want to drop your head down into the opposite direction. And if you feel a lot of increased symptoms going down the arm, go ahead and refer to my neck health video. Once again, drop the head down, put the hand here, push up lightly against the hand, again into this direction without changing the range of motion. The exercises for carpal tunnel syndrome is going to be strengthening that opposite muscle or the extensor of the forearm. So with a resistance band, bring the hand all the way down and then come up with resistance. So the hand is an extension. Come down where the hand is in complete flexion or the wrist is bent completely and bring it up. If you don't have a resistant band, you can use my famous can of tomatoes that makes its rounds in these videos. And do this for about 40 seconds, strengthening this area. And again, if you don't have a can, you don't have a resistance band, you could even just do resistance against your own hand, coming up and down in the full range of motion. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.